Hello, good evening, fellow Philadelphia citizens. I'm Larry Platt, the co-founder of the Philadelphia Citizen, and it's great to be with you. And you're not seeing double. This is me with my fellow bald man Ali Velshi of MSNBC, and a Citizen board member. It's been a while since we've brought our Citizen community together, and we've really been looking forward to this and to hearing from all of you, because we've all been, isolated and stir crazy. So this is what constitutes for getting out and about in 2020. So let me run through real quickly what the lineup is going to look like for tonight, before we get to the man that John Oliver calls the Velsh, which is, I think, a nickname that should take off nationally. Ali, the Velsh, and I are going to talk for about 20 minutes or so. While we're talking, you can post your questions, and I see that some of you already have, in the Ask a Question box on the screen. You can post question or comment in there, and then we're going to open this up town hall style after 20 minutes or so. And when we start talking about your question, and name you, you'll get a prompt on your screen to share your video, and accept that prompt, and then you'll be up on the screen alongside Ali Velshi. Try to control yourself because of your close proximity to such a charismatic star, and then everyone will be able to see and hear you, and this will be like an actual group conversation. This is the first time we've done this, so be patient if there are any technical glitches. We had a few just before when we were in the so-called green room. But I'm psyched. I'm psyched that so many people are here. I'm psyched that Ali's here. So let's just dive in. Anything new in your life, Ali?
Everything is new in my life. I have covered a lot of things, as you and I know. Some of the bigger ones. I started in my job in the United States right during 9/11. I covered the financial crisis. I've covered most of the big things that have happened in the world in the last 25 years. I've covered hurricanes and disasters and earthquakes, wars. This is actually unlike anything I've ever covered. There are just differences about this, not least of which is I broadcast from my home. I'm in my home. That's where I do the news from. This isn't the set I use. I use my home in New York for that. I'm in my Pennsylvania home right now. But we do all of it. We gather our news differently. We tell the news differently. And one of the biggest things, Larry, and this one is a little bit like some of the other big events that I've covered, and that is there's a big number and a big statistic and a big story going out there. New York has just surpassed 10,000 cases of coronavirus. But this is a real thing for every individual. And at this point, all of us are, if we're fortunate, 3 degrees separated from someone who has lost a battle with coronavirus. Most people I know are 2 degrees separated, and many are 1. We've lost somebody at NBC, and a number of my colleagues have lost a family member as a result. So it's the story of our time on one hand, but it's a real thing that is affecting people's lives. People are actually scared for their lives and their safety. And then those of us who are not scared for our lives and safety, we probably all should be, but if we're not, we're scared about our prosperity and the economy. So it's too much for the head sometimes. It's too much for the brain. This one is a hard one to process. And what do we all usually do when we want to process something? We hang around with other people. In my case, we eat, or we go to a bar. And you can't do that either. So on one hand, technology is helping us come together like this, and people are getting together for drinks over Zoom or over Skype or whatever the case is. But it is trying all of our minds, because the normal ways in which we seek solace or we seek comfort in times of discomfort, we cannot do like we have done in the past. So we are rewiring ourselves in a way, and I don't know what it looks like on the other side. Something will happen, and maybe we'll be better and stronger for it, but we will certainly be different, Larry.
Is it hard as you're doing the daily stenography? Literally every day there's that box on the screen that has a death count.
Yeah.
And I'm wondering, hearing you talk, how do you keep in mind in real time that every one of those statistics
is a person
people who loved and have had people who love them. It's got to be hard, and also, but you also don't want. You also have to shield your own emotions, otherwise you'll go insane.
So we do it 3 or 4 different ways. One is that I have started an email account called mystory@velshi.com. And I ask people to just share with me their stories and their photos and their videos of how they're coping with this. Doesn't have to be sad. It doesn't have to be happy. It doesn't have to be anything. It can just be, just talk to me. Just tell me what's going on. And every show I will read one of them. And some of them are funny and some of them are good and some of them are sad and some of them are things you hadn't thought about and some of them are tragic. Every show, one of my producers, Emma, does an obituary. We talk about a life that was lost. And I will tell you that the way she crafts them and the information she gets makes them positive stories. In fact, you always, every time I read it, before I read it on TV, I smile. And every time I read it on TV, I cry. Because when you're really telling the story of a real person, and it's a good story, and it's a great story of the things that made their family laugh or the things that people knew about them. But it makes it real. We also go out of our way to find people on the front lines. That might mean police and firefighters and EMTs, might mean grocery shoppers. It might mean doormen. It might mean home health care aides. Just the stories of the people who do not have the privileges of keeping inside their own home and getting their stuff delivered and not going to work. So that we continue to remember that they're out there so that we can stay safe. This is, I don't like using war analogies. I think we use them too much in society. I think we use them too much in the media. But in this instance, that's what this is like. So we really check ourselves. For every time I've got a governor or a mayor or a political candidate or even a doctor and an epidemiologist or a specialist, we try and make sure we've got real voices of real people who are coping with this on a daily basis. And I think together that gives us a complete story.
I think that's wonderful. And I know you when we've talked about this privately, you shy away from this, but I made the observation to you that in addition to all those frontline workers that you mentioned, journalists are frontline workers in this, and you play a particularly important role because we're all isolated, and in some cases, you're the only person a lot of people have spent time with.
So I have long said, Larry, you and I have talked about this many times, that there are really 2 things that journalists should do. The first one is bear witness. Just show people that it's happening. There are stories that you wouldn't know are happening, genocides happening around the world, things happening that you wouldn't even know about. That's job number 1. And job number 2 is speak truth to power, hold power to account. And in this story, both of those things are happening at the same time. We have to do both of those things. So the tally, the stenography, the death count, the obituaries, the photos people send me, the stories of how these frontline workers are out there is part 1 of the story. Bearing witness, writing the first draft of history of this, which will be the most influential and important time for many of us in our lives. Number 2 is speaking truth to power. And one of the things that happens in tragedies, in shootings, in hurricanes, and in times like this is there are people who say, and they say daily, this is not the time for that. There will be enough time later for pointing fingers. There will be enough time later for accountability. There will be time later for commissions and things like that. Except that's never true. The most important time to talk about gun stuff is in a shooting, because you got everybody's attention. The most important time to talk about climate change is in a hurricane or in a wildfire or in a tsunami, because you've got everybody's attention and you can see what the evidence is. And that's the same thing now, because we're not even in the 3rd inning of this thing. America spends more per person on healthcare than anyone else in the world, and we're having a tough time with this thing. This has not hit the countries in the Southern Hemisphere, in which it is summer now and it will be winter soon, who spend $1 or $10 a year per person on healthcare. We've not seen what that looks like. We've not seen what this looks like in refugee camps. We've not seen what this looks like in highly populated places where we do know in America, for instance, it's much more deadly in highly populated areas, just like TB. TB is the perfect map to look at to compare coronavirus to. It hits the poor and those who can't seek health care harder than it hits everybody else. That's why it's important for us to talk about the failings right now, because we're not finished. This thing has not hit some counties in America, some states in America in a meaningful way yet. It's hit us in New York. It's hit New Jersey a lot. So the holding to account, this isn't like a fire that started. This isn't like a hurricane that happened. This isn't something that's in the past. It is here, and I don't think we're past the halfway point yet. So the bearing witness and the holding people to account is the job that journalists have to do today. And if I get tired of it, and I get tired of the number of hours I spend on TV and the number of hours I work, because I work a lot, I look out my window. And I look at those delivery people, and I look at those doormen, and I look at those nurses and doctors on their break, and I look at the police, and I listen to the sirens of the firefighters and the EMTs, and then suddenly I'm not tired anymore.
That's wonderful. And I'll just share with people that during this I called you or emailed you because there was a day where I texted with you in the morning, turned my radio on, and heard you on NPR. Got out of my car, turned my TV on, and there you were. I was afraid to go to bed that night because I thought you'd be in the bed. And we don't want that. On March 21st, you looked at the camera, and we actually ran this at the Citizen, gave a really smart speech, but more than a speech, it was an exhortation for the country not to miss this opportunity. And it's a little odd to think that the virus is that has shut down the country is actually an opportunity. But you were talking about the opportunity to sort of remake society. Can you elaborate on that? Because I think it's a critical point that, and I want to ask you if we're heeding your advice so far.
So a piece of context here. If you look at some of the most important things that occur in an economy or in a society, you can often trace them back to an event, something that caused it to happen, caused people to fix something and change it. Not everything came out of a think tank or a bunch of smart people sitting around in a room or at a university. But when we look at the most serious problems, the intractable problems that we've got in our society, when we look at healthcare, when we look at growing inequality, when we look at climate, and we look at big solutions to that, doesn't matter where you are politically, people tend to stop because when they get to how you solve for those problems, those ones in particular that I just gave you, income inequality, healthcare, climate, but it can be any other ones, people say it really is going to cost a lot of money, and boy, it's going to be hard to change. I mean, every candidate who recommends something like the Green New Deal or Medicare for All, we ask them, how will you pay for it? How will you get it done? How will you get it through Congress? Well, guess what? Everything we are doing right now is going to cost a lot of money. And everything we are doing right now is really, really hard. We are busy remaking society at a higher price tag than we have ever paid. So my general view of this thing is, if a third of your house burns down, build it properly. Build the house you actually wanted to build. Why don't we fix a bunch of those things? The amount of money that we put into the economy on a daily basis since the beginning of this thing, whether it's the Fed shoring up the economy or the $2 trillion bill that was passed or more money that's coming in or unemployment insurance, this is way more money than, and I'm not making this point to advocate for it, but it's way more money than covering everybody's public university tuition. It's less money than giving everybody universal health care that every other developed country in the world has. We can actually deal with income inequality. If you spent this much money and put this many minds to it, you could do it. So the idea that a crisis causes you to be your best self, your most muscular self, your most provocative self, is something we should take advantage of now. We've been discussing the ills and the failings of society and politics and the economy for a long time. You are not going to get another thing like this, God willing, for the next 25 years or 50 years or hopefully 100 years. May we never live through anything like this again. But if we are living through it, why don't we use it to rebuild?
I think that's such an important thing to consider. It harkens back to, we now think of FDR in retrospect as hewing to an ideology, but in real time, they were just trying stuff because they were desperate to try stuff, and some stuff failed, other stuff worked and lifted the country up. And what you're saying, and so my question to you is, so far, have policymakers done what you've exhorted them to do. Is the $2.2 trillion sufficiently innovative to remake society?
No, but I will say this. It is easier for me to sit and write this and read it on TV than it is to do it, first of all. Secondly, I mean, when faced with a crisis, the first thing you have to do is, people will tell you, is put out the fire, right? But rather than discuss whether the 3-year-old should have had matches to light the curtains on fire. But first, we got to put out the fire. And most people agree that job number one right now is dealing with this virus, the people who get infected with it, and we're not even succeeding at that, right? Our testing is not adequate, our equipment is not adequate. I mean, the idea that we're scrounging for masks and gloves and things like this, again, this is the most sophisticated, wealthiest country in the world. That just shouldn't be happening. The supply chain arguments that we're having, the us versus them at a federal versus state level, the Jared Kushner coming out and saying the stockpiles are not for the use of the states, they're our stockpiles. So we're having a fifth grade conversation right now, and I'm sort of talking about PhD level fixing of the economy. So there's a disconnect. That said, at some juncture, there are moments at which billions and tens of billions of dollars are being spent on a particular thing. And sometimes there are people in the room who are having the right conversation. For instance, right now today, in fact, I was looking at my phone because I'm just waiting for a confirmation from one of the airlines that this has gone through. But apparently the Treasury and the airlines have actually come to a deal in which taxpayer money will go to the airlines to fund payroll until September 30th. Now, this is a uniquely European and some would say socialist way of doing things, right? It's what they've done in Denmark. They have basically said everybody stays on everybody's payroll. There's no unemployment. Nobody gets laid off. We pay 75% of some people's salaries, 90% of other people's salaries for the next 3 months. End of story. We're not going to have you file for unemployment. We're not going to do this whole backwards thing. Okay, so the airline example is the one place that we're trying this. It had a false start. There was some problem with it. I'm waiting to find out today whether it's actually working. If it works properly, and I don't know whether it has gone through the way it's supposed to, if it does, it will become a model for what we can do in other industries in phase 4 of this deal. The idea that let's be a little European about this. Let's not have everybody quit their job, go through separation papers with their company, do all that stuff, then get on the state rolls to try and get on unemployment, wait 2 weeks for that to happen, get that check, file that paperwork, and then hopefully get back to your job in 6 months. We're just going to skip all of that because it's more efficient. So there are little places where we are trying out different things. With healthcare, we've decided your testing and your treatment for coronavirus will be paid for. It's more complicated than that sounds because if you have an underlying heart condition and you go in, is that a heart problem and is that paid for or is that not? But we are making strides toward a more sophisticated way of doing things. I will say this administration is doing it kicking and screaming. It's not embracing the concept, but there are lots of people at the table when these deals are being made, and some of them are bringing some very creative ideas.
A mutual friend of ours, the brilliant Richard Vague, wrote a piece in the Hill.com a week or so ago in which he said that rather than a stimulus, what we really need, and I'm paraphrasing, what we really need is an economic pause so that and funneling of money to workers directly, which is sort of what you're saying, right? Yeah. So that for 3 to 6 months they're held harmless.
Correct.
And then
stay home, and there's no pressure to not stay home, right? Yeah. If that's what we need people to do. The fact is, if you are not prosperous in this society, then the remarkable pressure to listen to the president's bidding about getting back to work as soon as possible is very strong, right? You believe he's right. It's like, I need to get back to work. If you are wealthy enough to sit there and say, I can sit at home for another month, it's okay. We don't want these decisions being made because of politics. We want the right scientific decision to be made. And the reality is that it may mean some parts of the country stay home longer, some open up. We have antibody testing, which is free, so we can tell which one of us has had coronavirus, and if we have, do we have some immunity so you can go back to work? If I don't have it and I need to go back to work, what are the protocols for how I dress? What are the protocols in every restaurant in America, on every bus service or transit service? That's where we need to be thinking about it, but it needs to not be on wage earners to figure the future out for themselves. They didn't do anything to get into this, and we need to give them the freedom to say, if the public health officials say the best thing for you to do is stay home for another month, then do us a favor. It will cost us a lot less to not have you get infected or pass on this infection by staying home. So we'll take care of that. Now, again, in countries, again, mostly European countries where there is a system by which workers get things from the government more directly, it's a simpler system. In America, we have a system that is designed anything that you get from the government to be as hard as possible, right? You basically, it's always, you got to prove that you are owed something by the government. And generally it's on your taxes, right? You fill out a way more complicated set of forms than anybody else in the country does to get your own money back. Well, if you're not, it's not taxes. If you're on food stamps or you're on unemployment insurance or you're on welfare or you're on Medicare or Medicaid, they make it way harder. The general point here is that you probably don't deserve government money, so we're going to make it really hard for you to prove that you do. Europeans don't think that way, and that's helping them in this instance because they're sitting here saying, you know what, you deserve the money. It's going to be better for society if you stay home. We have to rethink this whole thing in America because it will cost us less money if people who are infectious are not out there feeling that they have to be out there infecting other people.
Right. We're obsessed with this idea of moral hazard. Right.
Really, yes. If you give people money, why would they go back to, why would anybody ever work again if you gave them money?
Right. Well, there's this thing called dignity. But you just demonstrated why I always refer to you as not just another pretty face on TV. The way that you think about ideas, and I want to plug your weekend shows on MSNBC because they're much more solution oriented than the usual, which I know is your passion, as you just demonstrated. Should we open this up town hall style and look at some of these yeah,
I see some good comments. So I'd love to hear some of these things because there's some really good stuff to talk about that people are very curious about.
Okay. Let's why don't we go to Nancy London, who has a question, which I knew we were going to get a bunch of questions.
Don't swear, Nancy, because in the chat you're swearing a little bit, so don't swear on this one.
Okay. But I knew we were going to get some questions about the president, of course. So let's have Nancy join us. And I actually have an idea that I wanted to run past you, Ali, which is David Boardman, the dean of Temple University Journalism School, had a great op-ed in which he said why he suggested that news outlets like MSNBC ought to tape delay, run the president's press conferences on a 10-minute delay and do simultaneous fact-checking. I thought that was really smart. Is that a possibility?
I think everything's a possibility right now, right? Because I have found myself on both sides of this argument. For 3.5 years, I've had people say, don't take, and this, by the way, this is when times were not nearly as serious, and it was Sarah Sanders who was giving the press briefing, and people say, why do you take that stuff? Or why do you tell us when the president has tweeted? And I have said for 3.5 years that it's the president of the United States. He can change policy. The things he says could have an impact on your life. And coronavirus is an actual living example of that. He can make decisions that could actually have an impact on your life. So my argument has been, it is not our job to curate the president out of your life, whether or not you like him. That's not the issue. If you don't like the president, you can not vote for him or vote for somebody else, but we can't choose not to have him. What has happened, however, in the last several weeks is that there has been a school of thought in that the information given out by the president as it relates to coronavirus and on Fox News has been misleading to the point that it can be dangerous to people. And if you look at polling from Quinnipiac, from Monmouth, and other polling, it does seem that people's views on whether or not they can contract this infection or various things about it are tied both to their partisan politics and to where they get their cable news from. I'm totally fine with where you want to watch your cable news. I'm not totally fine with people thinking that their rate of infection or their mortality rate or the way a virus moves around is different depending on whether you watch Fox or MSNBC or CNN or you vote Republican or Democrat. That's BS. And we've gone too far. That's the bridge too far. That now when people will lose their lives because they get bad information. By the way, I spent weeks, Larry. I talked about coronavirus in January with Lori Garrett and other experts. I spent weeks having people tell me, you people are blowing out of proportion. This is why people don't like the media. It's one thing to say it, but you guys are making this sound like it's going to kill a whole lot of people. I had sensible people say this to me. And that's my point, is that I can't curate for you what is going to happen. I don't know whether we're going into a depression or this is going to last 2 months or we're all going to work on May 1st. I don't know. So my default has been to try and give you as much information as possible.
Nancy declined to come on screen, but she was asking, like, why do you even cover the president? And you basically answered it. He's the president. You have to cover him, but you have to try and provide that all important context.
So that's a valid point, right? We're thinking about different ways of doing this. One of them, for anybody who watches MSNBC, you'll see in the last week, some of them are being handled by Brian Williams, who does a great job of sort of interrupting at certain points, recounting what the president said, going to a panel. Usually there's a journalist, a public health expert, maybe a doctor, and so they can evaluate it in real time. The other thing that we're not scared about doing anymore, because we've become used to it, we were taught as journalists, you don't say somebody lies, except if you can, it's evident that they're lying. Well, now we have enough evidence that we know when somebody's lying, so we're able to say that. The problem here is not to make this more politicized, right? We're not looking for a world that's yet more politicized. We're trying to hold the administration to account so that they don't tell people the wrong thing. They don't sell you on a particular drug if it's not the thing you should be doing, or they don't tell you that it's going to trickle down to nothing or it's going to disappear. Those are the things this administration has said. And there is a role to play by having people in that room questioning the president. Now, if those people in that room questioning the president don't have an outlet in which to report that in real time, it does dull the effectiveness. So I think that, just so everybody out there knows, this is a very, very vibrant, active, vigorous discussion that is being had. And we are trying to find our way around this. But it is easier when you have a remote in your hand to decide what you hate about the way TV is doing it than it is when you're trying to make a decision about the coverage. So we tend to lag behind a little bit in some of these decisions because we are trying to think through the multiple consequences of doing so, including the idea that at a press conference held by the President of the United States, he may make certain declarations about things that you deserve to know. This is uncharted territory. We've never been here before. We've never had to think about how do you manage or edit or curate a news conference held by a president of the United States. These are new times for all of us. We're trying to figure it out. But I'm with a lot of people who are frustrated about it. There are times when I'm watching it or covering it and I'm thinking, why are we doing this? So it's a work in progress.
Especially yesterday, where it was pure. It was a campaign rally. And let's see if Jessica D will join us. Jessica, I saw two questions from Jessica. One was just wanting to know all about your life and how you broadcast from home, which I think is interesting.
Yeah.
But she also raised a question about is this an opportunity for Jubilee? Will we have some sort of vast forgiveness of debt that remakes the economy? Both really interesting questions. We're inviting Jessica to join us, but I think we've got a room full of shy people. But
tell us, indicate to us in your question if you want to come on the screen to talk about it, because I'd love to talk to you directly about it. I'm always happy to talk to Larry, but I'm happy to talk to you directly about it. Let me take the second part of that question while we're waiting. I think there is an opportunity to actively consider those parts of debt that we believe are some of us believe are a little bit unjust in society, right? So there are a few kinds of debt that people accumulate in America that are different than they accumulate in any other world in any other country with a similar standard of living, similar income levels. Education debt is higher in America generally than it is anywhere else. Healthcare debt only exists in America for all intents and purposes. It's the only country in the world where the leading cause of bankruptcy is, in fact, healthcare. So those two types of debt, there have been active discussions about forgiving it, right? There are candidates who run on this platform. And I remind people, Bernie Sanders, whom I interviewed last Friday, just before he stepped out, there are opinions he holds that were thought to be radically way out there, including that people should earn a $15 minimum wage. Minimum wage in this country, the federal minimum wage is $7.25. $7.25 in a full-time job is $15,000. If you double that to $15 an hour for all those people who think the socialists are taking over, that's $30,000. So we're saying that there should be a minimum wage. A person should be able to earn $30,000. That's the crazy radical dream that we've got. The other radical dream is that people have universal health coverage. And I grew up in Canada where we've got it. It's not as robust as what Bernie Sanders was suggesting, and I'm not sure it needs to be. But every other developed country in the world has universal health care of some form or other. In other words, everybody's covered, or the vast majority of the population is covered. America is the outlier. In other places, public education is free to heavily subsidized. Now, in-state U.S. public universities, in some cases, are a very good deal. The University of California example is very strong. But these are the kinds of things that if you're fixing society and fixing debt, that's where you'd go first. Wipe out health debt, wipe out public college debt. If you go to, I had Susie Orman on my show on Saturday, and if you said, should we wipe out credit card debt? Because a lot of Americans have credit card debt and they don't work. She'd say, well, that's a choice. People bought things on their credit card. That's up for debate. Some people bought things because they had to buy food that they could live. But I don't think we're there. But we might be part of the way there. Who we got?
Is that Jessica?
Yep.
Hey, Jessica. Have at Ali.
Well, this brings me to my first question. Your broadcasts on MSNBC do not look like my Zoom meetings. And so I'm just desperately curious, because the things that I've been thinking about are pausing the television and looking at what books people have on their bookshelves behind them. And then wondering like how you and Stephanie Rule and Nicole Wallace look so put together, and I can do a virtual background, but it doesn't quite look that way.
That's the industry that is going to develop out of this whole thing, right? The how to do this. So I'll give you a few secrets, because none of us did any of this before this. There were no home cameras. There are a few personalities on TV with major shows that have taken a piece of their basement and made a studio out of it, but it has tended to be a very expensive thing. So first of all, it's a lot less money than people think. In fact, the gear in my house to broadcast with, I think the single most important, camera's obviously the most expensive part, but we have a teleprompter. That's expensive. But everything else is almost consumery in its way of doing things. So I've learned some lessons. So here in Philadelphia, I've used some of the lessons. The lighting in front is soft. Now, if it were correct lighting, you'd see the same amount of light on this side of my face as you would on this side. This is not professional lighting, but it's soft, and my background is lit separately. So I have two lamps that are on that background illuminating that, providing an illusion of depth. Now, it looks like I'm leaning up against this whole marble thing, but that's actually 20 feet behind me. So that's the quality of camera. We're never going to get that quality of camera off of a laptop computer. So part of it is, until we have high quality cameras, and that may emerge from it, you're not going to get it. Generally speaking, your phone camera on the back end is better than your computer camera. It's lighting. I have 25 years I've been in this business. 25 years I go in and get makeup, and I never learned to do it properly. So I have learned now that these parts of my face shine, and this part of my face shines, and this shines, and we try and do that. Fortunately, I have no hair to worry about, and it's kind of amazing. We're all amazed. The backdrop behind me, this is an actual fireplace, but on TV, the backdrop that you see at my house is a 65-inch TV. And they have the various backdrops of the show. They email them to me. I put them on a USB stick. I put it into the TV, and then I select, depending on if I'm doing my weekend show, which is called Velshi, or I'm doing an odd hour that isn't branded. We have coronavirus stuff. Every Friday night I do Lawrence O'Donnell's Last Word. That has its own background. The point is, it's a lot less sophisticated than you actually think. It's just photographers have told me since day one, it's all lighting. And they're right. It's the camera that you got and the lighting that you have.
And before you kick me off, I just want to ask you one last thing. You're at least half-time New Yorker.
Yes.
And so I'm wondering what you think of how Cuomo and de Blasio have handled the
de Blasio's been a little behind the curve on a few things. And I'm a little puzzled about that. I like him, but he has not been nearly as aggressive on this as Andrew Cuomo has been. Andrew Cuomo's press conferences are intriguing. They're data laden. He has sort of slide presentations beside him. He's definitely been the model. In fact, he was doing it, generally speaking, earlier than most governors were. The coronavirus hit Washington State earlier, but Jay Inslee wasn't doing press conferences back then. J.B. Pritzker started doing them in Chicago. Phil Murphy does them in New Jersey. There are a bunch of governors that do it, but Andrew Cuomo's is the standard. He's also one of the few people, and I've interviewed Governor Cuomo for years, and I've known him, and I know his brother Chris very well. He's an old friend of mine from CNN. But I will say that he has his game has been very strong in terms of keeping the public informed, giving them numbers, giving them statistics. And by the way, in some cases, they've been proved to be wrong because this has not been as serious in New York as he had predicted. And some people are being critical of him for it. I'm almost feeling that it's because he gave us all those numbers. We knew how serious this could get. So everybody, nurses and doctors came to New York. People sent their protective gear there. We got the ventilators we needed in New York. So I'm very impressed in general by the way he's been handling things.
Thank you so much, Jessica.
Good to have you.
Those are great questions. And let's go back to the crowd here and see if we can't find. By the way, there's one political leader who I've been falling in love with, Lori Lightfoot, the mayor of Chicago.
Oh,
have you had her on? She's been amazing.
So my last trip was probably ill-advisedly late. I was on the road a lot later than people were, and I actually had an event in Chicago. It was under a month ago, and I did the event, and then I went to do Brian Williams' show, Last Word, and I did it from our Chicago bureau. And I spoke to Lori Lightfoot that night about, they were canceling St. Patrick's Day, and they were the primaries were the following day, and they were talking about closing. A lot of the primary voting places were schools and nursing homes, neither of which could be in operation. So we were talking about the logistics of that. We were showing pictures of like Target stores where the papers that the paper products have been wiped out. And it was right at the front end. And her demeanor has been consistent and authoritative through the whole thing. So I think I agree with you. I think that is a person the world is going to want to see more of. And she's doing a strong job in Chicago. She has a unique problem in Chicago. It's unique to a number of cities through the middle of the country that have large African-American minorities, in which they are a percentage of the population, but a much higher percentage of the number of people dying as a result of coronavirus, which, as I said earlier, TB is a good comparison. It hits people with less access to healthcare in higher density areas who cannot make the choice not to go to work. And what you are seeing in Milwaukee, in Chicago, in other places like that, is the degree to which this is decimating minority populations harder than it is the general population.
And that gets us to, that's related to Michael Rugnetta's question. If we can invite Michael on. Michael asks, it's important to provide your audience with as much information as possible, but do you worry about information overload? How do you vet or condense information to make sure it's reliable and actionable? That's a great question. And
That's a really good question.
When we talk about Chicago, there was all this messaging in the Black community that was erroneous, that African Americans were immune to the virus. And so if we have Michael, that would be a great conversation to have. There he is. Hey, Michael.
Hi there.
Go ahead.
Yeah, great. So I'm just curious if you could speak to that, Ali, with regard to, how you sort of vet information, make sure that certain myths don't get out there, to disabuse people of myths and misinformation that's out there. How do you sort of distill and evaluate the reliability of information?
So this is obviously a problem we've been having for the last few years, right? So there's information overload. There are people who love what we do at MSNBC, and there are people who are my friends who say, I stopped watching a long time ago. I can't watch the news. The news depresses me. It gets me down. And we see the cycles in which that goes, by the way. They tend to be around events where there's been a big buildup, and then something happens and people don't like the outcome. In this particular case, the numbers indicate that people are back to and tuning into the news at a higher rate than ever before, because the news is fulfilling, generally speaking, a unique purpose for them, and that is safety. Right? There are certain reasons why you choose to consume the news, and there's a hierarchy of reasons, and at the top of them is you want to impress your boss or your wife or husband or girlfriend or boyfriend, whatever the case is. But at the bottom of them is safety and security and prosperity. And that's where we are right now. Your safety, your security, and your prosperity is threatened right now. And so people are tuning in. And there is going to be a moment where there's going to be a sameness to it, no matter whether it's 9/11 and terrorism, or it's school shootings, or it's hurricanes, or it's the financial crisis. There are moments where there becomes a sameness, where it's like, I've heard everything I have to hear. I get it. I know to wash my hands. I know what happens next. So in my world, something that Larry was alluding to earlier is that I really think a lot about structural failures and problems in society and the economy, including inequality. And these are places to have these discussions, right? There are places to say, I know you know every last fact that you need to know, and there's a thing on the side of the screen that'll tell you all the latest tallies on coronavirus. But while we're in this rebuilding society stage, why don't we talk about these other important things? I was on a podcast today with somebody whose newsletter I subscribe to, Emily Atkin. She writes a newsletter called Heated. It's a climate thing, and we were discussing, what happens to climate coverage. We were just sort of getting our feet into it, and it was becoming mainstream, and we were getting there, and now it's been completely blown out. And so I tend to always, as somebody who has a lot of time on TV and has a lot of topics at hand and has a great team, I've got a list of things that we're always ready to talk about. We just have to gauge, is this the right time? Are you ready to talk about something else? Are you ready to receive a different discussion? Or are we still in the moment and urgent and it's about something else? That's the constant balance and struggle that we have. What's the tone that's appropriate to you right now that you're feeling, and how much of that should I lead and how much of that should I follow and gauge from you? So the issue, there's more than enough stuff in the news to report on that we can connect to this. The issue is, at what point will you feel that I've registered the urgency of it, I'm following all the directions, I'm social distancing, let's move on to a different topic. We'll have to see. Thank you for your question.
Terrific. Thank you, Michael. Thank you. That's why we started The Citizen, was to focus in on solutions, not do happy talk, and not to bury your head in the sand, but to still point out problems, but give equal weight to the ideas and the people who are trying to make a difference. And in cities have become laboratories for experiments.
And this is that moment, right? This is that moment, because when I speak to epidemiologists and infectious disease people, they are thinking about the way we get back to work, right? What they're saying is that Donald Trump is 100% wrong in trying to set a date for a couple of reasons. One is that's stupid. And two is different places in the city, in the country, will have different moments at which it's appropriate for them to go back to work. But then it's not everybody either, right? Did you test to see if it's a pinprick test? Takes 5 minutes. Once that's distributed properly, you can tell whether you had the disease. Then we have to discuss whether there's immunity. Then we have to say the CDC says you need this much distancing. So do restaurants in our cities all have to change where tables are set a certain distance apart from each other? Do wait staff or service professionals all over our society have to have certain quality of protective stuff? Do we use UVC light? Because we know that you're supposed to keep your stuff outside because the UV light will kill the virus. Well, UVC light specifically kills the virus very specifically. So it's a $40 gadget that you can put, on top of the counter at a food service place, right? These are the conversations we should be having with people who are saying, hey, I'm gonna outfit all my shops with this. I'm gonna make sure all my workers have this. When we're ready to reactivate society, I'm going to be ready to go because we're going to try this new idea, which might become the way we do things forevermore, right? You remember the days before you had to go through that airport security the way we do now? It's the way we do it now. It didn't drive air travel to a halt at all. It made it a little more annoying also made it a lot safer. So that's what will happen. There will be things we do 5 years from now that will have been born out of today. And what a great time to try out some of those ideas and figure out what the most effective ways are of doing them. Because I want to get back out in society. I want to be out at crowded restaurants again. I want to be socializing with people. I want people who earn an hourly wage to have a way to earn that wage and interact with people. I don't want to live in a country where we're not interacting with each other. But if there's anywhere that we're going to invent new ways of interacting with each other safely in a way that's good for society, it's going to happen here, and it's going to happen in our cities.
That's exactly right. And the other thing, the other unintended ramification of all this is this is going to expose a lot of bureaucratic rules that weren't necessary in the first place, which will be really interesting because look, that $2.2 trillion is getting pushed through not as quickly as they said, but quicker than it would have been.
Any other time in history.
Yeah. Let's go to Andrew Rowan. Is Andrew with us? Soft spot in my heart for a first-year journalism student.
But he's going to be on this grade. Come on.
Yeah. So, and I love his question. Here he
is.
Hello, how are you?
Hey, Andrew. Where are you a student?
At Northwestern Medill School, and I'll be an MSNBC intern this summer.
Really? That's amazing. Well, nice to meet you. And this guy's already got the right idea. One thing that look at Andrew. Andrew's got the camera right in the right place for his face, because what typically happens on Zoom or Skype is this. Right? This is what everybody looks like on TV. So you can see all the curvatures of a person's nose, or people do it this way and they're dark or they're shadowed and all this. Andrew's got it figured out. So you've got a bright future ahead of you just from the way you positioned yourself in your camera, Andrew.
Thank you.
What can we do for you?
So you talked a lot about how you're having to make decisions you never thought you'd have to make in journalism, whether to take the Trump briefing or things like that. So I'm wondering if you think traditional journalism curriculums are sort of still relevant to today's media landscape? And then also, if you had to teach a new journalism course, what would it be titled?
If I were to teach a new journalism course, it would probably be titled how to cover the most intractable problem of our time, and that is inequality. Right? We're not equipped for that because that sounds like opinion journalism, and yet empirically, it's the biggest problem of our time. So is climate, and they're not unrelated. But the point is, we teach journalists to cover news as events, and so much more of news today is structure than it is event. Right? It is way more important that you learn to be a journalist to cover structural inequality, climate, things that happen, governance. There's a million issues around things that are not events. So this whole virus has brought into sharp relief. Should we be voting by mail? The census, fraud in elections, delaying elections. The Supreme Court put its thumb on the scale in favor of Republicans in Wisconsin the other day in a way that is actually, speaking to Jeff Rosen at the Constitution Center, is actually alarming. So these are. But that's an event, right? We're used to covering things because the Supreme Court did something, except elections and voting rights and census and inequality and healthcare and climate are issues every day, all the time. Somebody shouldn't have to die to do a story on why they didn't get the health coverage they needed. So that's what I would do. I would teach a course. I didn't think the name of that one out very well, but it was a quick answer. As for journalism schools, yes and no. If journalism schools are adhering to the idea, and I'm not suggesting my answer is completely right, but I think that I've said for years, journalism is two things, bearing witness and holding power to account. If you can continue to teach people how to do that, then you can teach them to be journalists. The craft changes every few years, right? You probably know how to do way more things than I ever knew at your age or many years into it, because when I graduated from school, you were either on camera or you were not on camera. You were a writer, you were a magazine writer, you were on radio. You had a very narrow band in which you operated. Now everybody is everything, and that's good. But in the process of bearing witness, meaning accurately telling a story and living up to acceptable standards of doing so, and holding power to account, meaning having the evidence and facts with which to challenge authority on their turf, then you're a journalist. And I do sometimes think that that's not taken seriously enough, that the craft is teachable. You're going to come and hang out in our newsroom, and we will make you a master of the craft in the course of your internship. And you make sure you find me, and we'll do it together. That I can teach easily. Going to universities to study this should be about the basic tenets of journalism, which are much, 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 much more important in 2020 than they have been at any other stage of my 26, 27-year career.
Thank you.
That's wonderful. And that leads
that's
to
what you do. I mean, that's you get it, right? Like this is nobody needs another article. Nobody needs another BuzzFeed list. That's not what journalism is about. By the way, BuzzFeed does some remarkable journalism. I don't mean that as a criticism. What I mean is nobody needs more crap on their phone. We need people to hold power to account and bear witness and tell us what's happening. Sometimes I do want to understand, based on my TV choices, whether I'm a salami or a pretzel, which is what BuzzFeed is good for. But most times I want real analysis about solutions to solve the problems that we're facing.
Thank you, Andrew, and good luck to you. Ali, you're so right. The one thing that is, and I say this to young journalism students all the time, I'm not as negative on the future of journalism, because one thing that's as old as our history are stories, the power of the story, and the means by which we tell stories might change, the technology of how we tell them, but there's something in the human spirit that needs storytelling.
Sure. Yeah, that's what you and I would have been in the old days, right?
Right.
In the days before fire, we'd be the storytellers. I will say that one of the best things to happen to journalism, and there should be an award in his name, is Donald Trump.
Why do you say that?
Because he's made it relevant. He's made it relevant to subscribe to those newspapers. I pay more in subscriptions today for all sorts of things that I get on my phone, many of which I don't have the time to read, because I want to support journalism, because I want to support people who are bearing witness and speaking truth to power. So I will support their initiative. And some of them are big things and some of them are little things, right? I used to have a New York Times subscription that I used, I'd get the newspaper in New York, but I'd use a subscription here or the other way around. Now I pay for 2 subscriptions because I want the New York Times to have my money, and I want the Washington Post to have my money, and I want newspapers to have my money, and I want the Philadelphia Citizen to have my money. So Donald Trump has proved that journalism is not free, and it is not easy, and that it has a very important place in our society.
Well, and that gets to Jessica D., who was with us earlier and asked you a question. I noticed another question she put up here, which was, after seeing CBS's Paula Reed pushing back against Trump yesterday, I'm wondering why more White House correspondents don't do the same. I wonder how you feel about that. We don't need more shouting, do we?
No, and it's hard. In the moment, it's hard. I invite everybody who's got a lot of criticism of journalists to try for a little while, particularly in that room. The mood is tough in that room. I think you're seeing more of it than you think you're seeing, right? So what you see is the moment that if you were there, it's kind of like watching a sports game, right? You're always sure exactly what that throw should have been and, what should have happened. You got to do this live with a guy who is hard to deal with. And I think there's more success than there are failures. So Paula was great. Yamiche Alcindor of PBS is great every day. I was texting with her today. I said, "You're the future of this industry." It's unbelievable. The other day, Yamiche had a question. The White House, the press briefing was in the Rose Garden. Yamiche had a great question. Trump ignored her, belittled her, went on to another reporter. And I saw Twitter light up with those other reporters should pass on their questions and hand the mic back to Yamiche. And it was very judgmental and very nasty. And 2 reporters later, a reporter from CNN did exactly that. And I felt like telling everybody, just watch the game play out for a second. We are playing as journalists. This is long. This is not a gotcha moment. None of us have Donald Trump's energy to play that little snipey game with each other. That's not what we do as a career. What we do is try to get them to answer the questions properly. It's like baseball. Your best hitters hit 1 in 3 times, right? It is not always easy. He comes out there knowing what message he's going to give. He's been primed by his people, and you've got to now you're picked in the order that you're picked, and you've got to decide, are you fighting back against the very last thing he said, or the thing that you thought he said 2 minutes ago, or are you trying to ask a different question so that you look different from every other journalist and follow a different thing? It's a harder game than it looks like. And I'm not subject to it because I'm not a White House correspondent, but they are some of our best correspondents at all networks. They're a very, very experienced crew. And I think what you're seeing these days is you're seeing everybody gets their moment. Everybody gets a glimmer and does something really impressive, and then it goes on to someone else. But what I do is very different, right? I book my guests. I study the topic. I book somebody like you. You and I will have an expert conversation. It might be somebody like Art Laffer, who I had on the weekend, with whom I don't agree with, but I know all the stuff, and I know what Art's going to say, and Art knows what I'm going to say, and we can have a robust conversation. Dealing with Donald Trump is a whole different animal that none of us were born to deal with. So I don't. History is yet to be written on how the White House press corps has operated. I'm more inclined to give them higher marks than most of the viewing public is.
And just a shout out to the New York Times story the day before yesterday that outlined in amazing detail just what Trump knew. It's the old Watergate line, right? The Howard Baker line. What he knew and when he knew it.
But you see, that's where the accountability can come from reporters who are working a beat and who are working on it and working their sources. It's in the moment, it's very, very hard to know what fact somebody just lied to you about, because you can't have an encyclopedia of all your facts. I have interviews on the economy. I've been following the economy for 30 years. There are not many numbers I don't have, but someone will come on my show and cite something that I know not to be true, but because I didn't expect them to lie about that, I don't actually know what the unemployment rate was in October of 2006. So they just told me it was something that I don't know is true, and there's no way in that moment I can figure it out to be true. So again, that's the heavy environment in which these White House correspondents work in. Now, you talk about delaying the White House briefing, maybe putting it on a 10-minute delay. As long as there's an infrastructure that allows for you in that 10-minute delay to check what was said and provide the audience with the right information. And I will tell you, because I've had this conversation with a lot of smart people, and you and I have had it, I've even tried to think about building a platform that is an instant fact-checking platform. It's going to be something that we need artificial intelligence for. It's going to need something we need algorithms and a different business model for. It's not just having 10 people around who are able to say, I think he's lying about that. Hey, can you check what the unemployment rate is? It is a more complicated endeavor than it sounds like. We should be doing it. It's on us to get this right, and I'm sorry that we haven't done it yet. But it's bigger than it seems. It's not just catching somebody in a lie.
Let's go back to Idisha Howard. I hope I'm pronouncing that right. I don't know if you want to join us, but the question is really interesting. How can I truly believe that my state will be prepared to open when I know there are asymptomatic people walking around affecting others? This is the great.
That's the big question. That's
fear.
everybody.
It's a real fear.
I've been led not. I mean, I have conflicting information every day between Cuomo and Trump and Pritzker and whomever else. I have conflicting information between Fauci and Trump doesn't like the World Health Organization. So I don't actually know who to believe. And then I've got hucksters who are selling claims on the internet. So when the government says it's time to go out, and again, here's the difference about being European or being Canadian. We weren't brought up to distrust our government, right? We haven't spent the last 40 years with people telling you not to trust your government. Now we've gone through that period of deregulation in the United States. It's probably 40 years old of everybody saying government is not to be trusted. There's nothing government can do better than what you can do. Smaller government is better. And then you have had the specific 3.5 years in which the people whom I always thought were the most important in government, the ones who earn a wage, who some of them couldn't make ends meet when the government was shut down, the people who are lifers in government, who are what we used to call civil servants, whose parents were civil servants because it was an office job, they're now the deep state. So we trust nobody. So now the truth is, when your governor tells you it's time to go out, polling has indicated people trust their governors more than they trust kind of anybody else except the CDC. So that's probably some good news. But this is what comes from not trusting your government, or your government giving you reason not to trust them. I truly, the 10-year-old me would have said, when the government says you need to stay home, you need to stay home. When the government says it's time for you to go back to work, you can go back to work. The 50-year-old me is a little less certain about that.
I hear you. All right, let's move on. Let's ask Denise Kelly to join us. Denise has asked a number of questions. One of which, who will be defending our healthcare workers when the administration is trying to silence them, which is an interesting phenomenon that's going on. You've had brave nurses on the air a few times, right?
Oh, we've had nurses, we've had emergency room doctors. We have, so I will say this, a few things have come of this. One is healthcare workers are the heroes of our time. And that goes from the EMTs, who, by the way, in most cities are the lowest paid emergency service, right? So you dial 911, depending on what you tell the person on the other end, they will dispatch an ambulance, fire truck, police, whatever the case is. When you get an ambulance, it's the lowest paid, generally speaking, on the rung, but these are the people who are going to save your lives. Home healthcare workers, who are the absolute lowest paid of anybody in healthcare. They treat our elderly and our, the people who can't move around on their own. They have no health insurance in most cases, no job security. And those nurses and those doctors, some of whom have come to the places like New York and Michigan, which are under siege and short of workers, who go into work every day knowing that they are likely to get infected. There are healthcare workers who have died. So healthcare workers have become the heroes of our time, and more broadly, even those who don't earn a ton of money. But we should have some respect for all these people. We don't pay our nurses enough in this country to start with. But healthcare, the concept of universal healthcare, has suddenly become important. About a third of all conservatives, people who identify themselves as conservatives in this country, now have some sort of support for universal health care. Maybe not Bernie Sanders' version of it, but universal health care, which I've always argued is really smart, because places that have universal health care spend less per capita for higher outcomes. Everybody says we spend 3 times as much as the OECD countries in America than any other OECD country, but we don't get better outcomes. There's only one place that America has better outcomes, and it's cancer treatment. On every other outcome, including longevity, the age at which you die, we're not actually better. So health has become more central to our conversation as a result of this. Healthcare, who provides it, how we pay them, how we pay for them, and how our healthcare is paid for, has become much more central to this discussion. And that is going to be a good outcome of coronavirus.
We were hoping that Denise would, but I think there's a technical glitch, so I don't know if
I see that you got a prompt.
Yeah. One of the things you were saying earlier reminded me of one possible ramification of this could be the return of respect towards competent government. The most prescient book written recently was last year's Fifth Risk by Michael Lewis, which was amazing because it predicted all of this in a way, because it basically was a profile of the Department of Energy, government, and other like departments, government workers who the Trump administration had forsaken the blocking and tackling of government. I wonder if competence might become in vogue again.
I hope. You just have to make sure that you haven't done too much damage to the institutions. What we know is, in the ones that have come under Trump's direct fire, the CIA, the FBI, you've had a problem in that recruiting has gone down. So, getting into the FBI is like getting into Harvard, right? It's really, really hard to do, except suddenly applications are way down because day after day, for 3 years, the president was criticizing the FBI. So you have to make sure you don't denude your service of these people. Now, the good thing about being a sanitation worker or some general department in the government, if you're not part of the focus of government, you still have to do your job. So, we will have more respect for them. But rebuilding faith in the mechanics of government will suddenly become important to us as well. I agree with that. Who we got here?
Is that Denise?
It's me.
Hey, welcome, Denise.
Finally got in.
Yeah, what's on your mind? You had a number. You posted a number of questions.
I did. I had questions about Bernie Sanders. I had questions about healthcare workers. It was actually the healthcare worker question that I was concerned about right now. I heard that the administrators themselves are trying to silence their own workers and threatening their jobs. And I'm just wondering who's protecting them. Their own administration is threatening their jobs.
Yeah, look, depends who you're talking about, right? The healthcare workers who are on the front lines are in hospitals and working in private practice in public hospitals. And generally speaking, they have been free to talk. Some will tell us, please don't use my hospital's name, or say that I'm a ER worker in New York, or whatever the case is. That's pretty typical. We haven't seen too much muzzling on that front. Working for the administration or working for a government agency is a completely different ball of wax. And so I look at Dr. Birx or Dr. Fauci up there, and there are some days when I have been very frustrated with both of them, because both of them have said things that have covered for Donald Trump. Dr. Birx had a few appearances on, one was on Fox, and I think one was on One America News, where she described Donald Trump's acumen for business as being a real advantage in this time, because he's a real data-driven guy. And I feel like those folks are important to us, and they are probably saving lives because they are up there being the adults in the room, and there are military people doing the same thing. But they know what happens to them when you talk out, right? I mean, look at that Captain Crozier on the USS Theodore Roosevelt. My military experts, and I never spent a day in the military, so I don't know these things, but I have people who tell me about it. They say you choose your people or you choose your mission. There are some moments that will come in a commander's life where you have to choose. The mission goes forward, or you save your people. And he made the decision that any human or any commander should make. He chose to save his people. He was right. Hundreds of them have COVID-19. They're on a ship. They sleep 4 or 6 to a bunk, to a room. And he got removed. But you'll remember when he got removed, the cheering that went on that ship as they walked him off and he saluted. And the backpedaling that this administration is doing now because of the criticism they have faced. Now, we had that video, so you can make a hero out of somebody because you actually see it happening. There are a whole bunch of people who get silenced quietly by this administration, or get silenced after the fact. Colonel Vindman, he testified before Congress. The Intelligence Committee, Intelligence Community Inspector General got fired last Friday night in the dark of night. It was 10 o'clock at night. Vindman's twin brother, whose only crime in life is being Vindman's twin brother, got from his job. So it's a vindictive administration. And those who, it's like riding a bull. Those who are up there try and hold on, knowing at some point they will get thrown off. And I think for Fauci and Birx and some of the other medical ones, they hold on in the hopes that lives will be saved because they are in the room to help make proper decisions. At some point they'll get thrown off, and the world, either post-coronavirus or post this administration, will reset. And to Larry's earlier point before you came on, maybe we will have a reset and we will respect people who have given their lives to their study, their profession, their government service. And that would be a great outcome of the new world, that we respect these people, including our nurses and our home healthcare aides, all those people who work in quiet silence. You know, I've noticed one thing in Manhattan when I'm there. Every night at 7 o'clock, we open our windows and we cheer and we clap for first responders. But we're clapping for first responders and for all of those other people who have to be on the streets. And what you mostly see in New York is guys who are immigrants, maybe they're documented, maybe they're not, delivering food, right? They're the lowest of the low on the totem pole. They have no power in society, no voice. And I like to think that when we're clapping, they're hearing those claps too. And the people who work in government are hearing those claps. And the people who know that they're on the front lines are hearing them too. And that when we come out of this, we will have a respect for those people whose daily work, just keeping your nose down, not seeking out the limelight, actually ended up keeping us alive.
I think it was the hospital administrators themselves that I was speaking directly to, why they would be threatening their own workers who are in, you know, such a critical state every single day that they go to work.
That's just corporate America, right? We see that all the time. We face it so most days you don't even know it's happening, because most companies have a rule that you can't talk about stuff without without them allowing you to, and they would like you to have either their CEO or their PR people on. Well, this is not that moment. We don't want to talk to your PR people. We want to talk to your frontline workers. We want to hear their stories. But that's sort of just a vestige. I don't think that's a conspiracy. That's just bad old corporate communications in America. We we are talking to a lot of frontline workers, and I think it's cathartic when one nurse sees another nurse talking, or one doctor sees another doctor talking. I think they think they're getting their story told.
Thank you so much,
Thank
Denise.
you.
Let's see if Toby will come on with us, and maybe this will be our last question or comment from the audience. But Toby asks a couple of things. He wanted to talk about, by the way, break a little news here. Donald Trump just halted funding for the World Health Organization. And so Toby has a question about that, and also about conflicts of interest with the media. There's Toby. Hi, Toby. Welcome.
How you doing? Thank you very
Great.
much. Thank you very much.
Pleasure.
Ali, thank you so much for speaking truth to power. I really appreciate it. We need more of you, more people like you, in commercial media and on cable news. I really appreciate you.
Thank you.
You're welcome. So I guess right now I just got on my left right here the press briefing, and I saw a Twitter feed, a Twitter update that he cut off funding to the World Health Organization. Now I know it's far from a pristine organization. I know it's had some challenges with its relationship with China. I heard some challenges with real reporting from Taiwan and things like that. I'm sure you know better than me. I was just curious. We need organizations like that at least, relatively speaking, are objective and we can trust, and we know they're not going to be partisan or have, hold sides and just focus on the truth. So what are your thoughts on organizations like that, and how we can, still have a relationship with them, but still hold them accountable, considering how many people they have, how many countries, and powerful individuals they have relationships with?
Yeah.
You know what I mean?
So this is important. You'll think of the IMF or the World Bank. These are global organizations, but they are powered by the United States, right? The largest stakeholder in the IMF, the World Bank, is the U.S. So it is a global from an international organization in which the U.S. government influences how things go, which is why those are organizations that the U.S. administration likes. You think about the United Nations, the World Health Organization. This administration in particular tends to not hold those organizations in favor. But you'll remember that one of the waves on which Donald Trump got elected was anti-globalization. And any organization that is not sort of governed by the U.S. or its outlook on the world is suspect, because are you taking some guidance from China? Are you favoring China? Are you enjoying a relationship with China? The World Health Organization, like the UN, you may think it's not the most efficient organization sometimes, not the most pristine, as you said. I think you're right. You've caught the nuances of it. But this would be throwing the baby out with the bathwater, right? They are a fundamental organization that has structures that operate, relationships that operate around the world. And sometimes in order to do that, you have to do things a different way. But like I said, this infection has not hit the most populous and most poorly prepared places in the world, in the Southern Hemisphere yet. We're going to need the World Health Organization to be able to replicate the things that we've done when there's a vaccine to get it out there. This feels like a distraction technique to me, right? There's been this sort of story going on in the background about how this is the China virus and it's the Wuhan virus, and the Chinese were dishonest about it, and the World Health Organization appeased them or somehow accommodated that. And it's a way of sort of focusing attention elsewhere, which is a characteristic of this administration. Mm-hmm. I think that there's a valid conversation to be had about the effectiveness of the World Health Organization. And while you're at it, we can talk about the UN and all these other these global organizations and what influences them and how effective they are. But the UN has solved not having a third world war, and the World Health Organization distributes a lot of information, a lot of healthcare around the world. So I think this is a distraction technique. This is something that Donald Trump puts out there. He's been floating it for a while. It polls well amongst the America First crowd, and so he puts it out there. Most public health officials, including Fauci, have said this is a bad decision.
Yeah,
I appreciate your nuance. If we would just look at everything with a little nuance and say it's not all black and white. This is not a ringing endorsement of the World Health Organization, but I don't know enough about the World Health Organization. I don't know what the intricacies of their organization are and what the pressures are on them. I'm not sure that the right thing to do at this moment is simply blame them and then cut off their funding at the point when the world is facing a pandemic.
Agreed. Thank you.
Quickly, Toby, did you want to ask about conflict of interest in the news?
Yeah, just in general. So, I mean, I've heard a number of situations, whether it's the Bush administration, whether it's the Obama administration, and the current one, uneasy relationships or, almost editorializing in some situations between positions of power and, news. For example, Jim Risen with the New York Times, that, and the Espionage Act being used potentially against Assange, you know what I mean, or Snowden. So your thoughts on that? I mean, obviously the free press and holding power to account, individuals like you are so important to democracy and keeping us, all of us, informed as well. So in situations where behind the scenes, some shady dealings like that occur, first of all, how prevalent is it, and how can we as citizens ensure that it doesn't happen?
Wow, that you picked a tough one for last. That's a big discussion, right? On one hand, we flourish because of freedom of the press and freedom of speech, and I'm a huge proponent of that. And I would like a world in which you had access to information that allowed you to evaluate the quality of information you were getting based on actual reliability. That's a whole different discussion for another time, because I don't know how we get there. That's part of the whole press briefing thing. How do we make it accurate? On the other side, influence and that question. Look, we've gotten into a crazy world, right? The world in which I grew up in, you had newspapers, you had magazines, you had radio, you had network TV, and the three TV networks largely told you the same story, right? Nobody can really explain to you why they liked CBS over ABC versus NBC. It was largely the same game, and they told you the same things. Now, what you call journalism is so many things, and the line between commentary and opinion and news is blurred. The line between left and right is blurred. You as a viewer or a reader or a listener don't really know when things have switched. And I'm a big fan of signposting. So my view is that you can say anything you want. Toby, I don't know, as long as I know who pays you or who made you say that or who's behind it, your opinion may be valid, right? You may think that we should power our society on coal. That's important to know. It would also be important to know if your paycheck is paid for by the coal lobby or a coal company or the government of the United States or whatever the case is. And I don't think journalism has kept pace with digging behind when opinions are published or when people say things, where they might be coming from. And then you bring up the whole other idea of pressure on journalists. So, I think, Larry, we should take that under advisement for another topic for a discussion, just sort of the stresses on journalism itself. These are all good questions, but too long. The answers are too long for this forum.
Yeah, that was great. Thank you, Toby.
Thank you.
And I think we'll end there. Ali, my heart is full because I haven't left the house, and this is the first contact I've had with anything other than my cat. But also because, as always, you've created, you've talked about things with nuance and deliberateness and without taking yourself too seriously, which is always important, I think, especially in these times. I can't thank you enough for this, and I can't, and my heart is full because we've gathered together as a Philadelphia citizen community, and that's what this is all about. I often say, you've heard me say it, Ali, that if the railroads of yesteryear had realized they were in the transportation business and not in the railroad business, our airlines today would be named the Atchison, the Topeka, and the Santa Fe. Right. And I think that newspapers, which I come out of newspapers, made the mistake of thinking they were just in the information business and not in the community business. And so we've been going crazy because we haven't been able to bring our community together to talk about important issues. So we're going to keep doing this. We're going to do one Thursday night. We're going to do one next week. And
you came out. This is, great discussions.
Yeah. Thank you all so much. And we'll see you Thursday. Ali will be, I'll see you when I'm in my Barca Lounger.
See you, friend.
Thanks, everyone.